Hi, I'm Claire McCarthy. I'm a pediatrician here at Boston Children's Hospital, and I'm with Eric Fleegler, who is an attending in our emergency department and is also the founder and director of Help Steps, a system that helps connect families to the resources they need. Well, Dr. Fleegler, can you tell me about your recent study?
Absolutely. Thank you for having me. So our study using Help Steps was looking at the role of using a system to help families and patients connect to social services, and we did this in our adolescent department. We had 405 adolescents, ages 15 to 25, take our service, and what we were looking at is how many social problems did they have, did they need help getting connected to resources, and if we were to give them referrals, would they make a difference?
What kind of social problems were you looking for?
So we're looking at a range of social problems. These included problems with getting access to health care, including things such as filling prescriptions, problems with their housing, including things being like homeless or having your utilities shut off, problems with things like food security, not having enough to eat. Also things such as wanting to get access to services such as gyms, nutritional food, finding out about domestic violence resources and other issues.
Now, I think when we think about a lot of these things, we tend to think about a lower income population, but our adolescent clinic actually serves a pretty broad demographic, doesn't it?
They do serve a broad demographic, and one of the things that we found is that these social problems affect all sorts of people. Now, certainly problems such as homelessness tend to affect people who are poorer, but we know that there are people who have all sorts of problems, especially things like domestic violence. It doesn't matter how much income you have, but even people who you would think are doing well off, they can often have social problems that would surprise you. They can be people who are having problems paying the rent, people who are having problems feeding their family.
And people may not always feel comfortable telling their doctor this, or their doctor may not have time to ask these questions.
This is actually one of the big things that we found in our survey. One of the issues is that when we said to them, you know, across these various social domains that we've been asking you about, and we asked about 9 different types of social domains, we found that the majority had not been asked about these questions at all, about 26% in any given survey, in any given social domain. And when we said to them, well, would you want to talk to your doctors? Actually, 84 to 90% across these domains said, yes, we would like to get help with this and we'd like to talk about it, but nobody was asking them the questions.
So what do you suggest for doctors in their practice? How can they do this? How can they find out about these problems?
Well, I think the first thing is just awareness. Being aware that these are prevalent problems is a big, big deal. And what we found in our study is that of these 405 adolescents, 76% actually had at least one major social problem, and 47% had 2 or more. So just being aware that there are a lot of problems out there is a big deal. The next question is, well, should we be asking these questions? Well, if you think it's important and you think it affects their health, and we know that they do, they're called social determinants of health for a reason, then you need to think, well, what am I going to do with these answers? And that's where Help Steps comes in. The goal is, if you're going to ask the questions, you want to be able to help them get connected to the services, and our system does just that.
Tell me a little bit more about Help Steps. How does it work?
So Help Steps is a system that takes you through kind of a process. The first thing it does is it's about a 10 to 15 minute questionnaire that just asks about problems in a variety of social domains. And as it goes through, it also asks them, well, do you want to get help with this? There may be a problem that they don't want to get help with, or they may not even identify a specific problem, but say, yes, you know, I really could use help getting access to, if I have a young child, say something like WIC or food stamps. Or, you know, I'm in a house, but I need further help and I'd like to get help with that. Or I'm in a domestic violence situation that I've not previously discussed. So after you've gone through the survey and said, this is what I would like to get help with, it actually takes your where you live and it says, these are resources in your community that can help you. And it allows them to make the decision about what type of referrals they want. So they actually, by the end of the time of using Help Steps, they have in their hands the paper referrals that have all the information about the resources that they've said, this is what I want help with.
Wow, that could be such a great help to pediatricians and to families. Do the pediatricians have access to this information as well?
Absolutely. So the way our system is designed, it can be used as a one-off. It doesn't even need to be used in a pediatrician's office. It could be used at home or in the library. You don't even need to go through the questionnaire. If you say, hey, I have a specific problem or I have a patient with a specific problem and I want to help them find this resource in this community, you can directly search our agency database, which has over 1,600 agencies in it. But if they use it in their office and they want to use it as part of kind of the actual screening and referral system, it can give them feedback about what's going on with their patients as well.
Wow, that would be very useful. I mean, 3/4 and half, those are huge numbers.
Yeah, and when we ask them, you know, it not only about has anybody asked you about these problems, but were you looking for a referral and did you get it? Over 75% said they were looking for a referral, but unfortunately, we had 43% said, I needed a referral, but I never got it. What was really exciting about our study is not only did we give them the referrals, and these 405 adolescents, they selected over 1,500 referrals to to a variety of social service agencies. We called them up 1 to 3 months later and said, did it work? And here's the exciting stuff that we found. 39% said they had contacted one of those agencies that they had selected for their top problem. So that's a huge step forward, saying 39% connected with a social service agency. And then we said to them, well, where are you with your social problem right now? And what they told us was 52% had either completely or mostly resolved that top problem. That's a big step forward.
That's a huge step forward.
What was almost more interesting to me is for the group that said they had not contacted that social service agency, 45% said they had either completely or mostly resolved that problem. Well, we said, well, how did you accomplish this? And they said, I turned to my clinic, I turned to my parents, I turned to another social service agency, but the consistent message they told us was this process of thinking about what are the help that I need, help them take the step forward to actually make it happen. So that was very exciting. So overall, 48% said they either completely or mostly resolved their top problem. And that's a major step forward.
It's a huge step forward, really, to helping people with things that are so important to their lives and things that we as pediatricians very often do not have time to, or the knowledge base really, to take care of.
These types of social problems, I think, quite honestly, give us a lot of trepidation because we don't want to open Pandora's box. And part of the idea of help steps is that you don't have to have that fear. You're actually going to know where to send people to and help them help themselves.
If pediatricians or any physician is interested in using help steps in their office, can they?
Absolutely. So right now we're in the process of trying to spread it throughout Greater Boston, and our system is www.helpsteps.com, and our contact information is there. And our goal is to be able to spread it not only within the Greater Boston area, but to other cities as well. And we're looking for partners who can work with us to expand the database and to be able to help them help their patients.
This is really exciting. Thank you so much for coming to talk with us about it.
Thank you very much for having me. It's really a pleasure.